There are three main skills you will learn in this lesson. You will learn how to identify dizygotic and monozygotic twins on ultrasound, identify complications that can result in high-risk birth, and to properly refer patients with multiple gestation to the hospital. There are three main terms that you will learn in this lesson: dizygotic twins, monozygotic twins, and twin-to-twin transfusion. Dizygotic twins are twins that develop from two separate eggs. These twins are not identical and are sometimes called fraternal twins. Monozygotic twins are twins that develop from one egg and are identical. Twin-to-twin transfusion is a condition where blood from one twin is transferred to the other, causing abnormal growth of both twins. About 1 to 2% of pregnancies result in two or more fetuses, which we refer to as multiple gestation. Complications in these pregnancies are increased both for the fetuses and the mother. Because of these possible complications, we need to follow pregnancies with multiple gestation closely. Some of these complications can include preterm birth and low birth weight, which puts the baby at a higher risk for dying and having health problems such as mental retardation, breathing, vision, and hearing problems. Fetal death. This is generally uncommon, but more common with multiple gestation than when there is only one fetus. Placental abruption. This is a condition in which the placenta prematurely separates from the uterus and causes bleeding. It can occur in the second or third trimester or after the delivery of the first baby. Obstructed labor. This is a condition in which one or both twins can become stuck in the birth canal during delivery. Multiple gestations should be delivered in the hospital in case cesarean section is necessary. In addition, there is a higher risk of developing gestational diabetes and preeclampsia, which can affect the health of the fetuses and mother. Ultrasound can identify all patients with multiple gestation. This is why the robust scan is so important. Without ultrasound, many multiple gestations are unsuspected at delivery. Because of the higher risks to the fetuses and mother, multiple gestations need close monitoring. The timing of the follow-up antenatal care visits and additional ultrasounds should be decided by the obstetrician at the referral hospital. All mothers with a multiple gestation should deliver at the hospital in case a cesarean section will be needed. Patients should not wait until their due date to go to the hospital. They should go at a date decided by the obstetrician at the referral hospital. In a normal menstrual cycle, the ovary releases only one egg. However, the ovary will sometimes release two eggs instead of one, and if fertilized by sperm, each can develop into a separate fetus inside its own gestational sac and with its own placenta. This is what we refer to as a dizygotic pregnancy, which formed from two embryos. This is the most common way twins develop. 7 out of every 10 twin pregnancies form in this way. This illustration shows dizygotic twins that developed from two embryos. Each twin has its own gestational sac and separate placenta. We call twins with two placentas and two gestational sacs dichorionic, diamniotic. Dichorionic means two placentas, and diamniotic means two amniotic sacs. Often, these twins are referred to as di-di twins for short. On ultrasound, you can often see a thick membrane separating di-di twins, especially if the ultrasound is done early in the first trimester. In less common situations, one egg is fertilized by a single sperm, then splits into two embryos, which makes two identical fetuses. The number of gestational sacs and placentas is determined by the timing of embryo split after fertilization. 3 out of every 10 twin pregnancies form in this way. If division of the embryo occurred in the first 3 days after fertilization, each twin will have its own gestational sac and placenta. These twins are also called dichorionic, diamniotic, or di-di, but in this case they are identical because they developed from a single embryo. In both dizygotic twins and monozygotic twins that split very early after fertilization, You will see the same features on ultrasound. You should see two separate gestational sacs, each with a fetus in the early first trimester. Later in the first trimester, you will see a thick membrane between the two sacs. This membrane may be difficult to see later in pregnancy. You may see two placentas, or the two placentas may look like one very large placenta in the second and third trimesters. This is a typical ultrasound image of a dichorionic, diamniotic, or di-di twin pregnancy. What can you see in this image? Please pause the video now to encourage a volunteer to identify structures in the image. Here you see two widely separated gestational sacs. Here are two images that are also typical of a di-di twin pregnancy at 10 weeks. Please ask a volunteer to identify what they see in the left image and pause the video. Here we have labeled the two gestational sacs, two fetal poles, and placenta that can be seen in this image. Note that the dividing membrane looks thick in this image, which is typical in a di-di twin pregnancy. There are two placentas in this pregnancy, but only one of the placentas can be seen in this image. What are the structures noted by stars in the right image? What is the large anechoic structure to the right of the twin pregnancy in the right image? The answer is that the stars marked two placentas that can be seen in the right image. The anechoic structure to the right is the maternal bladder. In this image, the dividing membrane does not appear as thick as on the left, but additional images are likely to show a thicker dividing membrane. What happens when monozygotic twins divide later than 3 days after fertilization? If embryo division occurs between days 4 through 8, the embryo will split into two identical fetuses, but this time only a single placenta will form with two amniotic sacs. This is called a monochorionic, diamniotic twin pregnancy. Monochorionic means that there's only one placenta for both twins, and diamniotic means that there are two amniotic sacs. On ultrasound, you can sometimes see a very thin membrane separating the twins. This membrane will appear thinner than what is usually seen in di-di twin pregnancies. Very rarely, embryo division occurs late, between 8 and 13 days after fertilization. At this time, only a single placenta and amniotic sac will form, which means that both twins are contained within the same sac. This is called a monochorionic, monoamniotic twin pregnancy to indicate that there is only one placenta and one amniotic sac. Fetal death is more common in this type of twins from umbilical cord entanglement. The last and rarest type of twins is conjoined. This occurs when embryo division occurs more than 13 days after fertilization. Conjoined twins are connected to each other and may share organs. They share a single placenta and one amniotic sac. On ultrasound, you will only see a single placenta in a mono-di or mono-mono pregnancy. There may be one or two gestational sacs depending on the timing of embryo split. If there are two gestational sacs, there's a very thin membrane between the twins, which is much thinner than what is seen in di-di or mono-di twin pregnancies. The thickness of the membranes is easier to determine in the first trimester than later in pregnancy. Very rarely, the membrane is missing, which indicates a mono-mono twin pregnancy that is at high risk for complications. This is a typical image from a mono-di